A handwritten record book discovered in 1973 inside the crumbling walls of Breathitt County Courthouse contained entries that made the demolition crew stop their work entirely. Page after page documented something that shouldn't exist in medical records. Male patients scheduled for appointments. A physician's wife listed as treatment. Before we dive into the story, I need you to do something for me. Click the like button and subscribe so you never miss another story that history tried to bury. Also, tell us in the comments where you're watching from and what time it is in your corner of the world, because these stories connect all of us across distance and time. Now, let's continue with the story. In the autumn of 1947, the residents of Gravel Switch, Kentucky, watched a black Ford automobile navigate the dangerous mountain road into their settlement. The vehicle belonged to Dr. Vernon Hadley, a physician whose arrival had been announced 3 weeks earlier in the Mountain Advocate newspaper. The county health department records preserved in manila folders that survived decades of neglect documented his credentials from a Cincinnati medical college and his stated intention to serve a community that hadn't seen a resident doctor in nearly 3 years. Gravel Switch existed as little more than a collection of weathered buildings surrounding the entrance to the coal mine that gave the region its only economy. Breathitt County sprawled across the eastern Kentucky mountains, a landscape of steep hollows and narrow valleys where isolation wasn't just geographic but cultural. The nearest town of any size lay 3 miles distant over roads that turned to impassable mud trenches during winter and spring. Men who worked the coal seams lived their entire lives within a 10-mile radius, their world bounded by ridge lines and the constant threat of rockfall or explosive gas. Dr. Hadley established his practice in a 2-story frame house on the settlement's single commercial street, a structure that had previously served as the mining company's administrative office. His wife Lorraine accompanied him, a quiet woman whose nursing school background, though incomplete, seemed adequate for a region desperate for any form of medical expertise. The initial reception was cautious but grateful. Coal mining demanded bodies and bodies required maintenance. The company physician who had served the camp previously had departed after a dispute over unpaid fees, leaving the miners to treat their own injuries with questionable folk remedies, and whatever pharmaceutical supplies could be ordered through mail catalogs. County marriage records and census documents from that period reveal the Hadleys had wed just 18 months before their arrival in Gravel Switch. Vernon was 34 years old, Lorraine 24. She had grown up in Hazard, another coal town 50 miles south, the daughter of subsistence farmers who had lost their land during the Depression. Her attendance at Louisville General Hospital's nursing program had lasted 11 months before financial pressures forced her withdrawal. The circumstances of how she met Vernon, or why a credentialed physician would choose such an isolated posting, remained unrecorded in official documents. The practice began simply enough. Miners came with a predictable catalog of industrial injuries, crushed fingers, respiratory ailments from coal dust, infections from cuts sustained in the darkness below ground. Dr. Hadley treated them with what appeared to be competence, dispensing medications and advice that seemed to improve conditions. He charged reasonable fees and accepted payment plans for those who couldn't afford immediate settlement. Within 3 months, he had become an indispensable figure in Gravel Switch, the kind of authority that isolated communities cling to when alternatives don't exist. The ledgers that survived in the Kentucky Historical Society archives tell a story that unfolded gradually through the spring months of 1948. Hadley's patient registry began showing peculiar patterns that would only become clear in retrospect. Men between 22 and 58 years old, all suffering from work-related conditions, received identical notations in the treatment column: home consultation required, follow up at residence, special arrangement authorized. By late May, 23 different miners had been assigned these appointments. The handwriting remained consistent. Dr. Hadley's practiced medical script documenting each referral with clinical detachment. What the ledgers didn't explain was why these consultations always occurred during daylight hours, when the doctor himself was making rounds at the mining camps, checking on men too injured to leave their beds, or examining new hires for fitness. The appointments were scheduled when only Lorraine would be home. Martha Cottle kept a diary that her granddaughter donated to the Breathitt County Historical Society in 1991. Martha worked as a midwife, one of the few roles available to women in the settlement beyond keeping house and raising children. Her entries from June of 1948 mentioned something she'd noticed while visiting the Hadley residence to deliver herbs she'd gathered for Lorraine's persistent headaches. 3 different men had arrived within an hour, each knocking on the back door rather than the front entrance designated for medical visits. Each stayed approximately 30 minutes before leaving through the same rear exit. Martha's words carried the careful phrasing of someone trying to make sense of observations that didn't align with proper behavior. She noted that Lorraine answered the door herself, wearing only a dressing gown despite the afternoon hour. The men who departed looked shaken, their gazes fixed on the ground as they hurried back toward the mining camp. One miner she recognized, a married man with 4 children, had tears on his face. Martha wrote, "I fear something unholy is occurring in that house, but cannot name it without proof, and speaking such suspicions against a doctor's wife would mark me as a gossip-spreading filth." The county marriage records office maintained a log of visitors for official business, but it also served as the central point for residents to collect mail too large for the post boxes installed outside the general store. The clerk, a man named Silas Drummond, kept meticulous notes about who came and went. His records show that in the 6 months following Dr. Hadley's arrival, foot traffic to the physician's residence increased by 300% compared to the previous doctor's tenure. More telling was the pattern. Virtually all visitors were adult males arriving alone, and they came only when Dr. Hadley's buggy was known to be away from the property. Coal company payroll records preserved at the University of Kentucky's Appalachian Studies Archive reveal another dimension to the emerging pattern. Several miners who had been model employees, never missing shifts, began arriving late or requesting time away during working hours. The stated reason in each case was medical appointments. The mining foreman, a man who noted such things in his daily log, observed that these appointments always fell between 900 in the morning and 300 in the afternoon, never evenings when families would notice absences, never weekends when Vernon would be home. A letter from Reverend Tatum to his denominational supervisor dated July 19, 1948, contained a single paragraph that suggested growing awareness of something wrong. He wrote that 2 men from his congregation had confessed to sins they couldn't name, weeping in his study and begging forgiveness for acts they'd been forced to commit to obtain medicine for pain that had become unbearable. When pressed for details, both men had simply stated that Dr. Hadley had offered them a way to continue their treatment without money, and they'd accepted terms they now deeply regretted. Weather records from the National Climatic Data Center show that the spring of 1948 brought unusually heavy rains to eastern Kentucky. The roads became nearly impassable, cutting gravel switch off from the outside world for weeks at a time. In this isolation, patterns that might have drawn outside attention remained contained within the narrow social boundaries of the settlement. What was happening inside the Hadley residence stayed there, a systematic operation where desperate men were being sent to Lorraine's bedroom as payment for the medications that made their injuries bearable. The medical records uncovered during the courthouse demolition revealed Dr. Hadley's methodology with chilling precision. Each file followed an identical structure. Initial consultation documented legitimate injuries or illnesses. Second visit noted complications requiring specialized intervention. Third appointment carried a notation that made investigators physically ill when they understood its meaning. Patient debt resolved through wife consultation protocol. What made these files particularly disturbing was the attached correspondence. Letters between Dr. Hadley and pharmaceutical suppliers in Lexington showed orders for morphine derivatives that far exceeded what a small mining camp would reasonably require. A supply request of 1948 asked for quantities typically reserved for hospitals serving populations 10 times the size of Gravel Switch. The pharmacist who filled the order noted his concern in a margin comment, but ultimately shipped the medication after receiving payment in full. Vernon was stockpiling the one thing desperate men would do anything to obtain. The power Dr. Hadley wielded became absolute through a simple mechanism: pain. Black lung disease ravaged the older miners, filling their lungs with coal dust until each breath felt like inhaling ground glass. Younger men suffered compressed spinal discs from working in tunnels too low for standing. Infections from untreated cuts could spread through a hand within days in the filthy conditions underground. Every man in Gravel Switch faced a choice between agony and seeking help from the only physician within a day's travel. Vernon controlled access to relief, and he discovered how to monetize that control in ways that transcended simple currency. Financial records seized during the later investigation showed how Dr. Hadley transformed medical necessity into sexual coercion. A miner named Jacob Lansing owed $42 for treatment of a crushed foot, an amount equal to 6 weeks of wages. When Jacob fell behind on payments, his prescription for laudanum was suspended. The pain returned with devastating intensity. Within days, Jacob was back at the office, willing to discuss any option that would restore his medication. Court depositions taken in 1949 included testimony from miners who described the carefully constructed trap. Vern would examine an injury, prescribe medication that actually worked, then schedule a follow-up appointment. When the bill came due and payment proved impossible, Vernon would lean back in his chair and explain the situation with clinical detachment. The debt was real. The medication was expensive, but there existed an alternative arrangement that would satisfy the financial obligation while ensuring continued access to necessary treatment. The arrangement was simple and monstrous. Lorraine would provide what Vernon termed therapeutic services at the residence during scheduled appointments. These services had nothing to do with medicine. They were sexual encounters that Vernon arranged, scheduled, and documented in his files with the same attention to detail he applied to legitimate medical procedures. Men who agreed found their debts forgiven and their prescriptions renewed. Men who refused found themselves cut off from pain relief entirely. The depositions, sealed for decades before being released to researchers, contained accounts that followed a consistent pattern. Minors would arrive at the house during designated afternoon hours. Vernon would greet them, confirm the appointment, then leave for his rounds. Lorraine would be waiting. The encounters typically lasted between 20 and 45 minutes. Afterward, the men would leave through the back door, and their medical files would be updated to reflect debt satisfaction or treatment continuation. Several victims described the psychological torment of these arrangements. They were married men with families raised in communities with strict moral codes about fidelity and proper behavior. The shame of what they were doing consumed them, but the alternative was returning to work with untreated injuries that would worsen until they could no longer perform their jobs. Losing employment meant losing company housing, which meant their families would be homeless in a region where survival without shelter was nearly impossible during winter months. Raymond Deckard's testimony provided the clearest picture of what happened to men who refused. When Vernon proposed the arrangement, Raymond had walked out of the office immediately despite his infected leg wound. His prescription was terminated that day. Raymond attempted to treat the infection himself using turpentine and folk remedies his grandmother had sworn by. The infection spread. Within 3 weeks, the tissue had died to the point where amputation became necessary. He made the agonizing journey to Lexington for surgery that cost more than a year's wages and left him unable to work underground. His family lost everything. Vernon had created a system where sexual access to his wife became the currency that purchased relief from suffering. The isolation of Gravel Switch meant no alternative sources for medication existed. No other doctors, no pharmacies. The nearest hospital lay in Lexington, impossible to reach for men who couldn't afford transportation. Within this closed system, Vernon held complete control over who received mercy and who endured torment, and he'd chosen to exercise that control in the most depraved manner imaginable. Lorraine Pritchett had been 19 years old when the bank foreclosed on her family's farm outside Hazard in 1942. County tax records show the property sold for a fraction of its value to cover debts accumulated during 3 consecutive failed harvests. Her father found work in the mines. Her mother took in laundry. Lorraine, the eldest of 5 children, enrolled in nursing school with money borrowed from an uncle who expected repayment with interest. The Louisville General Hospital training program accepted 42 students that year. Lorraine's entrance examination scores ranked in the middle third, adequate but unremarkable. Student records preserved in the hospital archive show she completed 2 semesters successfully before financial difficulties forced her withdrawal in March of 1943. The tuition payment for her 3rd semester never arrived. A notation in the registrar's file indicated she'd requested a deferment, but was denied based on existing institutional policy. What happened during the following 3 years remained largely undocumented until investigators pieced together fragments from employment records and witness statements. Lorraine worked briefly at a textile mill in Lexington, then as a server at a boarding house that catered to traveling salesmen. A former co-worker interviewed in 1949 recalled Lorraine as withdrawn and anxious, someone who avoided conversations about her past and seemed perpetually afraid of something she couldn't name. She met Vernon Hadley at a medical conference in Louisville during April of 1946. Lorraine had been hired as temporary staff to manage registration tables and direct attendees to various presentation rooms. Vernon was 33 years old, recently licensed to practice medicine, and attending alone. They married 3 months later at a courthouse in Franklin County with no family members present. The marriage license application listed Vernon's parents as deceased and his previous residence as Cincinnati, though later verification revealed inconsistencies in both claims. Testimony from divorce proceedings filed by Lorraine in 1951 after Vernon's imprisonment painted a portrait of psychological manipulation that began during their courtship. Vernon had presented himself as a rescuer, someone who recognized her potential and wanted to help her complete her nursing education. He'd spoken of establishing a practice where her skills would be valuable despite her incomplete certification. The promises dissolved after the wedding. There was never money for school. The move to Gravel Switch happened without her consent or input. Letters Lorraine wrote to her sister in Hazard, discovered in a trunk after her sister's death in 1987, revealed the progression of her entrapment. Initial correspondence from late 1940s expressed cautious optimism about their new life. By February of 1948, her tone had shifted to vague mentions of Vernon's demanding nature and strange requests. A letter from April contained a passage her sister had underlined multiple times. "He has begun asking me to do things I cannot describe in writing. Things that violate everything I was taught about marriage and decency. When I refused, he withheld food for 2 days and told me I had no value beyond what use he could make of me." The psychiatric evaluation conducted during her trial revealed the full scope of Vernon's control. He monitored all her correspondence, reading letters before allowing them to be mailed. He controlled every dollar, giving her no independent access to money. He isolated her from potential friends in Gravel Switch by spreading rumors that she was mentally unstable and prone to dramatic fabrications. When she'd attempted to leave in early 1948, walking to a neighbor's house to ask for help reaching her family, Vernon had retrieved her and spent the night detailing exactly what would happen if she tried again. He would tell everyone she'd been prostituting herself. He would have her committed to an asylum. Her family would believe she'd gone mad. By the time Vernon implemented his system of using Lorraine as payment for medical debts, she'd been so thoroughly broken down that resistance seemed impossible. The evaluation noted she'd developed a form of learned helplessness, where she simply complied with whatever Vernon demanded, because fighting had never resulted in anything but worse treatment. She performed the sexual acts with minors because refusing meant beatings, starvation, or threats against her family members back in Hazard. The question of her culpability consumed legal scholars for decades. Court transcripts show the prosecution initially argued she was a willing participant who benefited from the arrangement. But testimony from the minors themselves complicated this narrative. Several men described how Lorraine would sometimes weep during the encounters. Others noted she appeared drugged or deeply dissociated, going through motions mechanically while staring at nothing. One minor testified that she'd whispered an apology to him, saying she had no choice and begging him not to hate her. The defense presented evidence that Lorraine herself had been a victim of systematic abuse, groomed and controlled by Vernon until her capacity for independent decision-making had been destroyed. Yet even the sympathetic psychiatrist acknowledged the moral complexity. She'd participated in acts that harmed other people. She'd known these men were being coerced. Victimization didn't erase agency entirely, even when that agency operated under conditions of extreme constraint. The truth was that Lorraine existed in a category that the legal system of 1949 struggled to address, simultaneously victim and participant, coarse but aware, trapped yet complicit in trapping others. The Gravel Switch Mining Company payroll ledgers from 1948 documented wages that barely sustained life. A coal loader earned 75 cents per day. A timberman who reinforced tunnel ceilings received 1. These amounts represented gross pay before deductions for equipment rental, lamp oil, and mandatory purchases from the company's store, where prices ran 30% higher than independent merchants in distant towns. A miner named Curtis Mallory worked 6 days each week and brought home $4 after deductions. His wife and 3 children lived in a 4-room house owned by the mining company, for which $2 of monthly rent was extracted directly from his wages. Food costs consumed another $12 monthly. Winter heating required coal purchased from the same company that employed him, an irony lost on no one. The mathematics left nothing for medical care, clothing replacement, or any emergency beyond immediate starvation. When Curtis crushed 3 fingers in a roof collapse during September of 1948, Hadley's initial treatment bill came to $8. The subsequent prescription for pain medication cost another $200 monthly. Curtis fell behind within weeks. His file notation from October was brutally direct. Patient unable to meet financial obligations. Wife consultation arrangement proposed and accepted under duress. Financial records seized during the investigation revealed Dr. Hadley had implemented a systematic pricing structure designed to create indebtedness. Minor injuries that required only basic treatment were billed reasonably. Conditions demanding ongoing medication or repeated visits carried charges that exceeded what miners could pay from regular wages. The gap between cost and income became the leverage point where Vernon could propose his obscene alternative. Men who initially sought help for legitimate medical problems found themselves trapped in an arrangement where continued access to pain relief required sending themselves to appointments where Lorraine waited in her bedroom. The economic trap operated with mathematical precision. A miner injured badly enough to need ongoing care faced immediate financial crisis. Refusing treatment meant working in agony until the injury worsened to the point of permanent disability. Accepting treatment meant accumulating debt that could never be repaid through wages alone. Vernon's alternative eliminated the debt while ensuring medication continued, but the price was participating in something that violated every moral principle these men held. Testimony from Curtis Mallory during the trial described the psychological devastation of the arrangement. He was a deacon in the Baptist church, a man who'd never been unfaithful to his wife in 15 years of marriage. The first time he went to the Hadley residence for what Vernon called a consultation, Curtis had intended to refuse regardless of consequences, but Vernon had met him at the door with Curtis's medical file and a bottle of laudanum. He'd explained calmly that Curtis's pain medication was being discontinued effective immediately, unless alternative payment was rendered. The pain from Curtis's mangled fingers had become unbearable. He'd been unable to sleep for 3 nights. His supervisor had warned that missing work would result in termination. Curtis agreed. He climbed the stairs to the bedroom where Lorraine waited. The encounter lasted perhaps 30 minutes, though Curtis testified he dissociated so completely that he remembered almost nothing except shame so profound it felt like a physical substance coating his skin. Afterward, Vernon gave him the laudanum and marked his file as current on payments. Curtis returned home to his wife and children, unable to meet their eyes, carrying a secret that would corrode his sense of self for the remainder of his life. The cycle continued for 6 months. Every 2 weeks, Curtis had an appointment. Every 2 weeks, he climbed those stairs. Every 2 weeks, he received his medication and hated himself more completely. He began drinking heavily despite having no money for alcohol, trading possessions for moonshine that offered temporary oblivion. His wife knew something was destroying him but couldn't extract an explanation. The shame was too immense to speak aloud. Dr. Hadley's pharmaceutical records showed the economic brilliance of his scheme from a purely mercenary perspective. He purchased morphine derivatives for approximately 40 cents per dose. He billed patients $3 per dose. When patients couldn't pay in currency, he extracted payment through his wife's sexual availability, which cost him nothing in direct financial terms while generating continued patient dependency and revenue from other services. The exploitation operated on multiple levels simultaneously, extracting both money and sexual access from a population that had no ability to resist or report. What made Vernon's system particularly monstrous was how it transformed the victims into perpetrators of their own moral destruction. These were men with families, men who believed in fidelity and righteousness, men who'd built their identities around being good husbands and fathers and community members. Vernon forced them to violate their own deepest values as the price for relief from physical suffering. The psychological damage exceeded the physical injuries that had brought them to his office initially. Several victims testified that they'd contemplated suicide, believing death preferable to continuing participation in acts that made them despise themselves. The debt never ended because bodies continued breaking down in the coal mines. New injuries appeared. Chronic conditions worsened. Each man caught in Vernon's system faced a recurring nightmare where relief from pain required submitting to encounters that destroyed their souls incrementally. And they couldn't speak of it, couldn't seek help, couldn't even acknowledge to each other what was happening because the shame was too devastating to share. The silence that surrounded Dr. Hadley's practice didn't emerge from ignorance, but from the particular social architecture of Appalachian mining communities in the late 1940s. Church records from the Breathitt County Baptist Association reveal a population deeply invested in codes of privacy that bordered on absolute. What happened within a family stayed within that family. What occurred between individuals remained unspoken. This wasn't mere discretion but a fundamental organizing principle of mountain culture. Reverend Isaiah Titum served 3 small congregations in the Gravel Switch area, traveling between them on horseback each Sunday. His letters to the denominational headquarters in Lexington, preserved in the Southern Baptist Historical Library, contain careful language about moral concerns in the community. An August 1948 letter mentioned that several men had stopped attending services, and their wives offered vague explanations about illness or work obligations. Titum noted a general atmosphere of shame that seemed to hang over certain families, but attributed it to the grinding poverty and dangerous work conditions rather than any specific transgression. Another letter from November of that year came closer to acknowledging something darker. Titum wrote about a conversation with Martha Cottle, the midwife, who'd expressed worry about the unusual number of men visiting the doctor's residence during hours when the doctor himself was absent. Titum's response revealed the limitations of his ability to intervene. He'd considered speaking with Dr. Hadley directly, but recognized that doing so would require making specific accusations he couldn't substantiate. Mountain etiquette demanded he mind his own affairs unless directly asked for guidance. The women of Gravel Switch existed in their own network of information exchange separate from the male world of mining and formal community leadership. Quilting circles, canning cooperatives, and informal gatherings at the general store created spaces where observations could be shared in careful language. A notation in Martha Cottle's diary from December 1948 recorded a conversation with Agnes Mallory, Curtis's wife, who'd become withdrawn and stopped participating in the women's sewing group. Martha had asked directly if something was troubling the family beyond their known financial struggles. Agnes's response, recorded in Martha's precise handwriting, revealed the psychological torment afflicting households touched by Dr. Hadley's arrangement. Agnes said her husband had become distant and refused to discuss his medical appointments. He'd begun drinking heavily despite their inability to afford spirits. When she'd pressed him about what happened during his visits to the Hadley residence, Curtis had simply stated that some things were better left unspoken and that she should be grateful they were receiving medical care they couldn't otherwise afford. The mistrust of outside authority ran deep in eastern Kentucky communities that had seen union organizers beaten by company security forces and government officials consistently side with mining interests over worker welfare. County sheriff's deputies were often on company payrolls. State labor inspectors rarely ventured into the isolated camps. Federal authorities existed as distant abstractions with no relevance to daily survival. This historical experience created a reasonable assumption that reporting problems to outsiders would accomplish nothing except inviting retaliation. Church deacons and community elders, the informal arbiters of local disputes, found themselves unable to address situations they couldn't openly acknowledge. The Baptist Church maintained strict positions on moral behavior, but those positions assumed sins that could be named and confronted through spiritual counsel. What was happening in Gravel Switch existed in a category outside normal transgression, something too shameful to speak aloud even in the privacy of confession. The isolation worked in multiple dimensions simultaneously. Geographic distance prevented access to alternative authorities. Economic dependence eliminated the possibility of leaving. Social codes prevented discussion. Cultural mistrust discouraged external reporting. Within this perfectly contained system, Hadley operated with complete impunity, protected not by active conspiracy, but by the structural conditions that made intervention impossible from both within and without the community. Thomas Quincaid had worked the coal seams for 16 years when a support timber collapsed across his left shoulder in early March of 1949. The injury wasn't immediately catastrophic, the kind of crushing trauma that killed men outright in the tunnels. Instead, it was the more insidious variety tissue damage that would worsen without proper treatment and turn septic if ignored completely. Hadley examined him at the mining camp infirmary, a single room with a cot and basic supplies. The shoulder required daily cleaning and fresh dressings to prevent infection. Thomas received instructions to report to the Hadley residence each morning for wound care. The first 3 visits proceeded as expected. Lorraine changed the dressings with competent efficiency and sent him back to light-duty work. The 4th appointment began differently. Vernon was present this time, reviewing Thomas's file with exaggerated concern. The infection risk remained high, he explained. The wound showed signs of potential complications that could spread to the bone without aggressive intervention. Treatment would require specialized medications that were expensive and not covered under the basic care arrangement. The bill would come to roughly $60 over the expected treatment period. Thomas earned $4.50 weekly. The mathematics were impossible. Vernon's alternative proposal came wrapped in clinical language about payment flexibility and customized care protocols. Hospital admission records from St. Joseph in Lexington filed 2 weeks later documented what happened when Thomas refused. The shoulder wound that had been healing under Lorraine's initial care began deteriorating rapidly. Thomas's file showed that after his refusal, the quality of wound dressing materials changed. Instead of clean cotton bandages, he received reused cloth that hadn't been properly sterilized. The cleaning solution shifted from proper antiseptic to diluted alcohol that burned but didn't effectively prevent bacterial growth. Within 5 days, clear signs of infection appeared. Within 10 days, the infection had spread deep into the tissue. Thomas requested additional care. Dr. Hadley examined the worsening wound and prescribed medication that would cost $12 payment required in advance. Thomas couldn't produce the money. Vernon suggested perhaps Thomas had reconsidered the alternative arrangement. Thomas, feverish and in escalating pain, refused again. The prescription remained unfilled. By the 3rd week of March, Thomas's wife Beatrice watched her husband's condition spiral beyond anything she could address with home remedies. The fever spiked to dangerous levels. The infected tissue began showing signs of necrosis. She borrowed a truck from a neighbor and drove Thomas 43 miles over mountain roads to Lexington, a journey that took nearly 5 hours given his deteriorating state. Joseph Hospital's emergency admission documents recorded a patient in septic shock with an infection that had progressed to life-threatening levels. The attending physician, Dr. Malcolm Strickland, specialized in occupational medicine and had treated numerous mining injuries throughout his career. What he observed in Thomas's case struck him as suspicious. The wound itself wasn't severe enough to have generated such an aggressive infection without neglect or intentional contamination. The pattern of tissue damage suggested inadequate or deliberately poor care. Strickland's initial questioning met resistance. Thomas claimed he'd simply been unable to reach proper medical care due to distance and finances, but as the fever broke over the following 2 days and antibiotics began controlling the infection, Thomas's resolve crumbled. Lying in a clean hospital bed, receiving competent care from professionals who asked nothing beyond standard fees, he began describing what had been happening in Gravel Switch. The account emerged in fragments across multiple conversations with hospital staff. Thomas spoke of the coercion, the impossible debts, the alternative arrangements that other men had accepted and he'd refused. He named Dr. Hadley specifically. He mentioned other miners who'd undergone similar experiences. Dr. Strickland documented each detail in notes that would eventually become part of the official investigation file. Strickland contacted hospital administration on March 18, 1949. The conversation that followed was documented in hospital executive meeting minutes preserved in the Kentucky Medical Association archives. The administrators initially hesitated, concerned about potential liability from making accusations against a licensed physician based solely on one patient's claims. But Strickland pressed the issue, arguing that the pattern of deliberate medical neglect, combined with the coercion allegations, demanded immediate reporting. Joseph Hospital sent a formal complaint to the Kentucky State Medical Board by telegraph that afternoon. The message, terse and clinical, noted credible allegations of medical malpractice, improper patient care, and potential criminal conduct by a licensed physician operating in Breathitt County. The board's response came 3 days later, requesting detailed documentation and witness availability for a preliminary investigation. Board inspector files show that 2 investigators, Gerald Hutchins and Robert Finch, received assignment to the case on March 23. Both men had backgrounds in medical licensing enforcement and had previously handled cases of physician misconduct in rural areas. They understood the challenges of investigating allegations in isolated communities, where residents might be reluctant to cooperate with outside authorities. Their journey to Gravel Switch began on May 2nd. Delayed by bureaucratic procedures and the difficulty of coordinating with local law enforcement, Breathitt County Sheriff Vincent Pruitt agreed to provide a deputy for the investigation, but made clear in written correspondence that his department had limited resources and couldn't guarantee protection if the inquiry provoked community hostility. The investigators traveled with Deputy Earl Whitfield, a young officer who'd grown up in a neighboring coal camp and understood mountain culture. The investigation team spent 11 days in Gravel Switch conducting interviews in homes, at the mining camp, and in quiet corners where men could speak without being observed. The 47-page report they eventually compiled documented a pattern of systematic abuse affecting far more victims than Thomas Quincade's initial disclosure had suggested. 19 men agreed to provide formal statements. Each account followed the same basic structure: legitimate injury or illness, mounting medical debt, alternative arrangement proposed, ongoing coercion masked as continued medical care. The investigators noted that these 19 likely represented only a fraction of actual victims, as many men refused to participate in interviews or denied any knowledge of improper conduct when questioned. The physical evidence proved equally damning. Dr. Hadley's patient files contained billing irregularities, where debts were marked as resolved without corresponding payment records. Pharmaceutical order logs showed medication quantities that far exceeded legitimate medical needs for a community of Gravel Switch's size. Cross-referencing appointment records against the doctor's known whereabouts revealed dozens of instances where patients were scheduled to visit the residence during hours when Vernon was documented elsewhere. Perhaps most compelling was the financial analysis. Bank records subpoenaed from the First National Bank of Hazard showed deposits into the Hadley accounts that significantly exceeded what his patient billing could generate. The investigators calculated that Dr. Hadley's documented medical income for 1948 totaled approximately $3,200. His bank deposits for the same period exceeded $7,000. The source of the additional funds remained unaccounted for in legitimate business records. The investigators also discovered discrepancies in Dr. Hadley's credentials. A telegram exchange with the Cincinnati Medical College he'd claimed as his alma mater revealed that while Vernon Hadley had indeed attended the institution, graduation records showed significant gaps. His degree had been granted under circumstances the college registrar described as irregular, involving credit transfers from another institution that couldn't be verified. The Kentucky Medical Licensing Board had apparently accepted his credentials without thorough verification, a failure that would prompt policy changes in subsequent years. On May 13th, the investigators concluded their fieldwork and returned to Frankfort to compile their findings. The evidence package they assembled would form the basis for both medical board sanctions and criminal prosecution. Deputy Whitfield arrived at the Hadley residence on June 8, 1949, accompanied by 2 state investigators. The arrest warrant charged Dr. Vernon Hadley with medical fraud, criminal conspiracy, and multiple counts of improper medical practice. Vernon answered the door in his shirt sleeves, a coffee cup still in his hand, showing no surprise at the presence of law enforcement. He set the cup down carefully and asked if he could retrieve his coat. Lorraine stood in the hallway behind him, her face completely expressionless. The deputy noted in his report that she appeared neither shocked nor relieved, simply hollow, as though something essential had been extracted from her long before this moment arrived. She was placed under arrest as an accomplice, though the charges against her would later be modified based on evidence suggesting coercion rather than willing participation. The trial began in September at the Breathitt County Courthouse, drawing attention from newspapers across Kentucky. The Lexington Herald ran daily coverage describing the proceedings in language that suggested both horror and fascination. Reporters noted the unusual nature of the case, crimes that existed in a category rarely prosecuted, committed against victims whose shame made them reluctant witnesses even when offered legal protection. 32 men ultimately provided testimony as documented victims. Their statements, transcribed across hundreds of pages of court records, painted a portrait of systematic exploitation that had operated for 18 months before Thomas Quincade's refusal broke the pattern. Several witnesses broke down during testimony, describing violations they'd never spoken of to their own families. Defense attorneys attempted to discredit their accounts by suggesting financial motivations or coordinated fabrication, but the consistency across independent testimonies proved impossible to dismiss. The prosecution presented the financial records showing unexplained income, the pharmaceutical orders demonstrating excessive medication procurement, and the credential discrepancies revealing Vernon's partial falsification of his medical background. Expert witnesses testified about proper standards of care and how Dr. Hadley's treatment protocols had deviated in ways that suggested deliberate harm rather than incompetence. Vernon maintained throughout the trial that he'd been providing necessary medical services to an underserved population, and that any alternative payment arrangements were legitimate barter agreements common in rural medical practice. His attorney argued that economic desperation in mining communities often led to unconventional arrangements that shouldn't be criminalized. The jury deliberated for 7 hours before returning guilty verdicts on multiple counts. The judge's sentencing remarks, preserved in court transcripts, addressed the unique nature of the crimes and their impact on a vulnerable population. He noted that Dr. Hadley had violated the fundamental trust placed in physicians and had exploited the desperation of men who had no alternatives. The sentence of 12 years in the Kentucky State Penitentiary represented one of the longer terms handed down for medical misconduct cases in that era. Lorraine's separate proceedings resulted in a drastically different outcome. Psychiatric evaluations submitted to the court documented years of psychological abuse and coercive control by Vernon. Her participation, while not entirely involuntary, had occurred under circumstances that severely limited her agency and decision-making capacity. The judge placed her on supervised probation with the requirement that she leave Kentucky and have no contact with Vernon or any of the victims. None of the 32 documented victims received financial compensation. The Hadley assets, when liquidated, barely covered legal fees and outstanding debts. Many families left Gravel Switch in the months following the trial, seeking fresh starts in other mining regions where their connection to the scandal wouldn't follow them. The community itself seemed to contract inward, the population declining as younger workers chose employment elsewhere rather than remain in a place marked by such profound violation. The mining company continued operations for another 15 years before the scene played out and Gravel Switch gradually transformed into a near ghost town, its remaining structures slowly collapsing into the encroaching forest. Academic interest in the Hadley case emerged 2 decades after the trial concluded. Dr. Elizabeth Garner, a sociologist at the University of Kentucky, encountered references to the case while researching healthcare access in Appalachian mining communities during the 1970s. The sparse documentation in regional newspapers led her to the archived court records, and what she discovered there prompted a broader investigation into how such systematic abuse could have flourished undetected for so long. Her 1978 published study, titled Medical Authority and Exploitation in Isolated Communities, examined the structural conditions that enabled Dr. Hadley's crimes. Geographic isolation eliminated alternatives. Economic desperation created vulnerability. Social shame prevented disclosure. Cultural mistrust of outside authority blocked intervention. Each factor alone might have been overcome, but their intersection created a perfect trap where victims had neither escape routes nor advocacy mechanisms. The case began appearing in medical ethics curricula during the 1980s as medical schools grappled with questions about professional responsibility and oversight mechanisms. Dr. Harold Brennan at Eastern Kentucky University developed a course module specifically examining how credential verification failures had allowed Vernon to practice despite irregularities in his background. The Kentucky Medical Board implemented stricter licensing procedures directly in response to deficiencies revealed by the Hadley investigation. What made the case particularly significant to researchers was its challenge to prevailing assumptions about victimization. Academic literature on abuse and exploitation had historically focused on women and children as primary victims, operating under frameworks that didn't account for the experiences of working-class men in contexts where masculine identity and economic provider roles created unique barriers to disclosure and intervention. Dr. Patricia Vance, a psychologist who studied trauma in Appalachian communities during the 1990s, conducted interviews with descendants of several victims. She found that family silence about the events had persisted across generations. Sons knew their fathers had been involved in some scandal related to the doctor, but learned few specifics. The shame didn't dissipate with time, but rather calcified into a kind of inherited silence, where even asking questions felt like violating an unspoken rule. The broader implications extended to ongoing debates about rural healthcare access and the vulnerabilities created when medical professionals operate in environments with minimal oversight. Advocacy groups focused on underserved populations began citing the Hadley case as evidence for why credentialing standards, regular inspections, and accessible reporting mechanisms couldn't be treated as optional in remote areas. Breathitt County Historical Society maintained archives related to the case, though local resistance to discussing it remained strong even 70 years later. A historical marker proposal in 2015 generated controversy, with some residents arguing that commemorating such events would perpetuate negative stereotypes about Appalachian communities, while others insisted that acknowledging historical injustice served an important educational purpose. The marker was never installed. The last surviving documented victim, a man who'd been 24 years old during the events of 1948, died in 2009. His obituary made no mention of the Hadley case. His children, interviewed by an oral history project, described their father as someone who'd carried an unnamed burden throughout his life, becoming withdrawn whenever conversations touched on his early years in the coal camps. Vern Hadley served 9 years of his 12-year sentence before dying of a heart attack in the penitentiary infirmary in 1958. Lorraine disappeared from public records after her probation ended. Researchers attempting to trace her later life found no marriage records, employment documentation, or census information that could be definitively linked to her. The story lives now primarily in academic journals and archival collections, a case study in how power operates in spaces where accountability mechanisms fail, where isolation becomes weaponized, and where the victims of abuse remain voiceless long after justice theoretically arrives. If this story moved you to think differently about the hidden darkness that can exist in places we forget to look, click that like button and subscribe so you're here when we uncover the next buried truth that history tried to erase. These stories matter because remembering prevents repetition.